Class of 2012, friends, family members, supporters. Many of you will recognize the name of Dr. Bill Foege, one of the great figures in public health worldwide and an individual who had a long and distinguished history of connection with this school. Bill Foege recently received, quite justifiably, the Presidential Award of Freedom. He had an extraordinary career in public health, including a very high-impact stint as director of the CDC. In 1984, shortly after he stepped down as CDC director, he offered the following advice to his colleagues. If the Centers for Disease Control is to maintain the reputation it now enjoys, it will be because in everything we do, behind everything we say, as the basis of every program decision, we see faces. So in the few minutes that we have together, I'd like you to come back with me in time to the ER of Grady Memorial Hospital in Atlanta, Atlanta's only level 1 trauma center and only public hospital, where I met two parents one night, not unlike your own. It took them 2 hours to reach Atlanta from the North Georgia mountains. I faced them across the outstretched body of their son. As the nurse led them into the trauma bays and closed the heavy leaded doors behind us, the noise and chatter and beeps of the ER kind of quieted down, and it was the two of them, their son, me, and some life support machines. A ventilator was hissing rhythmically, 12 breaths a minute. A chest tube was bubbling constantly. You could hear the beeping of the cardiac monitor. Dad was staring down at the floor. He couldn't make eye contact. He was just trying to hold it together and process what had happened. The mother was staring straight into my eyes. I spoke first. I said, "Your son was in a terrible crash. His truck left the road at high speed. The EMTs could tell he was critically injured. That's why they called a helicopter. He reached us about 2 hours ago. He's got several internal injuries, none of which immediately require surgery. He's also got a collapsed lung. But those aren't his biggest problems. It's his brain injury that worries us the most." At that moment, Mom interrupted and said, "Doctor, I don't know how to ask you this, but I must. My husband lost his job 6 weeks ago. I work, but my employer doesn't offer health insurance. Is my son," and then her voice broke, "is my son going to get the care he needs?" I looked at her as she cried, waited a moment, and then I said, "Ma'am, you're at Grady Hospital, one of the South's great trauma centers. Everyone who works here does it because we believe in what this place stands for. I swear to you, we will do everything in our power to save your son." I meant what I said, but I didn't tell her the whole truth. I didn't tell her, and our best may not be good enough. And if your son survives, he'll probably be disabled for the rest of his life. I didn't tell her, and you'll be billed for the helicopter ride, the ER care, the days to weeks to come in the ICU, and your bill, your son's bill, will probably exceed $250,000, maybe more. I didn't tell her, and because of who you and your husband are, you'll do everything you can to make good on that bill. You'll mortgage your house, you'll sell your farm, you'll empty your savings, you'll try to borrow money from your other family members and friends, and it won't be nearly enough. And the unpaid balance of your bill will push one of the South's great trauma centers closer to insolvency, closer to its own crash." But perhaps most sadly of all, I didn't tell her that her son's devastating injuries were completely and utterly preventable. If he hadn't been driving so fast, if he hadn't had 2 beers before he headed for home, if he'd only buckled his seatbelt. 25 years of emergency medicine has made me a zealot for public health because I have seen what happens again and again when public health fails. Tragic moments like these, however, are balanced by moments of triumph, moments of victory, moments of great satisfaction. It's immensely gratifying to know as a physician that when you care for a patient and make a difference, that you can see it, you can feel it, and they know it too. That eye contact, that handshake, that thank you, it keeps us going. As public health professionals, you're not going to get much of that. You're not. Your patients, who are in fact every member of the communities you will serve, may not even know you exist. They may not have a clue what you've done to help them, what tragedy you've prevented, how their lives would be totally different but for your efforts. So you're going to have to substitute that handshake, that eye contact, that thank you, with the knowledge that in some small way, or perhaps in some very large way, your efforts, your ideas, your work will change the lives of hundreds, thousands, perhaps millions of people. I am absolutely certain that over the course of my career, I saved far more lives with my public health work than I did in 25 years of clinical practice in one of the busiest ERs in America. You will too. Great challenges await you. Some are on the other side of the world, some are just up the street. When I was a UW public health student, it was not uncommon to read in the Seattle newspapers stories about gun violence in Los Angeles. Imagine how I felt last week as I read the Los Angeles Times about gun violence in Seattle. This is particularly ironic for me because my first major study as a UW public health student was an analysis of firearm-related fatalities in homes in King County, Washington. That research culminated many years later with a 10-year partnership with the community, law enforcement, and prosecutors focused on reducing gun violence in Atlanta, Georgia. That effort used the foundation principles of public health, epidemiology, prevention, program evaluation, and we made a big difference. Gun violence and gun homicide dropped like a rock during that period of time. It works. Each of you will find comparable opportunities in your career, in your area of passion or your area of expertise, and by doing so, you will save the outcomes of countless stories. Thanks to work that each of you will do, a woman in West Africa won't die in childbirth. A child in Haiti won't die of cholera. A young family in India won't be devastated by polio or measles or some other very preventable disease. 3 teenage girls in Bellingham will receive their high school diplomas because they will not die in a car crash the night before graduation. And maybe, just maybe, no mother in this country in the future will have to ask the ER doctor if her son will get the care he needs. Multiply these stories by millions, and you begin to grasp the power of public health. Class of 2012, you're graduating from one of the world's great universities and one of the finest schools of public health on the planet. With the receipt of your degree, you're going to join the ranks of one of the noblest professions on earth. Those of you who are gathered here today to cheer you on, and many more who wanted to be here but could not attend, are very, very proud of you. When this ceremony is concluded, I encourage you to celebrate this wonderful occasion and enjoy the heartfelt congratulations of your family members, your loved ones, and your friends. Then go home and get a good night's sleep. Because tomorrow morning, you have a world of work to do. Congratulations.